this is Mark Laslett speaking from New Zealand in 2016. This short video is to tell you about my course on diagnosis of persistent low back and referred lower extremity pain, which is offered by Southern Musculoskeletal Seminars. This course is spread out over 6 months, the majority of which is carried out online. There are 3 seminar days for practical workshops, discussion, question and answer sessions, and troubleshooting. The initial course will require attendance at the seminar days, but it is planned that all online content will become available from 2017 as a multimedia book and course. This course is a natural evolution from the many courses I have taught in the UK, Scandinavia, Europe, North America and Australasia over the last 30 years. I have been extremely fortunate to have been in a time and place to meet and work with some of the greatest clinicians of the 20th century. With regards to clinical diagnosis, I have had the very rare opportunity of being able to compare my clinical diagnoses with the most sophisticated reference standards available in a blinded manner, provided by my good friend and colleague Dr. Charles April and his outstanding team in New Orleans. His hospitality, generosity and willingness to have me examine his patients over a 6-year period and within the context of my doctoral studies is the primary foundation of this course. The material of this course has benefited from the knowledge and experience of many colleagues and friends all around the world. As a consequence of this background, I believe that a clinical diagnosis is possible for most patients suffering persistent low back pain, and this may be achieved with reasonable accuracy without the need for invasive or expensive techniques such as guided injections or high-tech imaging. This course is intended to achieve a number of objectives. 1. To give active musculoskeletal clinicians a much greater depth of instruction in lumbopelvic diagnosis that can ever be achieved in the traditional short course seminar format. The new format makes use of the new standard in postgraduate education, which is the Moodle online learning environment. Southern Musculoskeletal Seminars will develop the program and resources as time goes on. 2. Because of the new online learning system, it is intended that course participants can cover most of the course content in the comfort of their own home or office, rather than have the same instruction rushed through in a conference or classroom environment. The possibility of having lectures paused or repeated enables the participant to acquire the information at his or her own pace. 3. It is intended that the face-to-face seminar days will be limited to 3 days, each separated by sufficient time to complete self-directed reading and review of the audio-enhanced PowerPoint presentations, which are available through the Moodle online learning system. The online PowerPoint presentations will be like having me personally tutor you in the subject. The seminar days will be dedicated to practicing examination techniques, discussion, question and answer sessions, and responding to problems that have arisen during the preceding days and weeks. 4. The prime objective is to upskill active musculoskeletal clinicians in the art and science of diagnosis as it applies to the lumbar spine and pelvis. After successful completion of this course, you should feel comfortable carrying out evidence-based clinical diagnosis for patients who have been referred for specialist care, be that in a surgical or non-surgical, secondary or tertiary environment. The course will require you to engage in a lot of reading. PDF documents of required and recommended reading will be available for download from the Moodle online learning environment. All PowerPoint presentations that would normally be given in a seminar will be available online, so you will not have to endure hours of sitting, developing backache, in a course with colleagues around you making noise and distracting you. The material is broken up into 9 sections, and you will self-examine your understanding of the material in a managed sequence using online quizzes, the results of which are retained to provide a record of your achievement. Forum and webinar type meetings are included in the program. You will have the opportunity to submit case studies for evaluation and discussion. For continuing education credits, the full course will constitute about 100 hours of instruction. In New Zealand, this is the number of hours required in a 3-year period to maintain registration as a physiotherapist. In fact, you'll probably spend more time in total. In all, there are about 13 hours of lectures, 10 hours of patient videos, with more being added all the time. Some of the patient videos are of less common disorders and some of the common presentations. There are over 200 papers you will have to read, at least in part. Some instruction in reading EMR and other high-tech images is included with case studies. This course is an intensive training program at a master's or clinical doctorate level, focused entirely on the lumbar spine and pelvis, that aims to prepare you for specialization in musculoskeletal diagnosis as it applies to the lumbar spine and pelvis. Finally, I'd like to comment on a question that does arise. In many university courses, diagnosis of the lumbar spine is actually frowned upon. While this may seem bizarre to some, there is evidence that when specialists provide a diagnosis to patients, there can be a number of possible negative effects. Depending on how the diagnostic information is provided and how the patient hears the information, there is a tendency to equate diagnosis with a surgical intervention for persistent low back pain. This is because a diagnosis is often based on high-tech imaging, such as MRI, and is often couched in patho-anatomic terms. This is what surgeons tend to focus on as well. For those clinicians who have concerns in this regard, I would like to assure you that I'm not a surgeon and that diagnostic information we provide for patients is delivered in a way that encourages non-surgical care options first and recommends invasive interventions such as injections or surgery in only that small proportion of cases for whom this is the only or obvious best option. Diagnosis is information, and information is power, for good or ill. The focus of this course is to empower clinicians and their patients to better understanding and better management of lumbar spine problems. Practical methods of identifying confounders of diagnosis and management, such as central sensitization, neuropathic pain, and illness behaviors, are an integral part of this course. These central nervous system problems are considered part of the diagnostic process, not separate from or conflicting with it. For now, you can sample a PowerPoint presentation from one of the early segments of the course for free by accessing the Southern Musculoskeletal Seminars website at www.musculoskeletal.courses and clicking on the Open Access Material tab. You can follow Southern Musculoskeletal Seminars on Facebook and keep in touch by following me on Twitter at @MarkLaslett_NZ or use the hashtag SMS_course. Thank you for your attention.